Right. Well, welcome everyone. Thank you so much for joining us on a Saturday morning. It looks like you can communicate through the chat, and I'm just really appreciative of everyone who is here and appreciative of the DART Center who is providing this training. Just a little background, I actually did a DART Center training last year at the IRE conference on trauma-informed reporting. And I've been in this industry for more than 10 years, so I think you can feel kind of jaded that anyone can teach you something new at this point, but I actually learned a lot about different techniques for interviewing people who are either recovering for trauma, or something that I learned from the session was if you're interviewing someone who is unhoused and living on the street, they're actively going through trauma. So you need to think about that in the context of how you report your stories, how you interview people. And it really hit home for me actually 2 weeks ago. I met a viewer and she said, I really like your reporting because I like how you give people agency. And I thought that it was interesting that just from watching the stories that people had noticed that I was doing that, something that you would think is maybe only seen behind the scenes. So I'm really enthusiastic to do this today. And whether you are experiencing stress, burnout, or trauma from this job, I'm sure someone in your newsroom is. So I hope that you can pick up some ideas on just how you can be a supportive colleague and how we can all weather the storms better. And here to do that is Dr. Kate Porterfield. She's a psychologist, right?
Yep.
Yes, and she's with the DART Center, which specializes on journalism, and I think as being, they're just a really key part of changing the conversation in our industry about how the news does affect us and how we need to take care of ourselves. So thank you so much, Dr. Kate.
Thank you, Kate. It's so nice to be here, and I am really honored to be spending time with you all on a Saturday. I know that journalism creeps into all days of the week and all hours, but I also know that it can be nice to have a day off. So if you're doing this on your Saturday, that's a day off. I'm glad you're here, and I'm going to try to make the next hour actually very applicable to life as a journalist, because in my mind as a psychologist, there's a lot that we can learn about trauma and stress that we can start applying immediately. You don't have to have extensive therapeutic experience to address well-being as a journalist. So I'm going to try to teach you all some tools and some frames that I find really helpful for journalists in doing what we're going to call trauma-facing work. And just a quick minute, I am going to do a fair amount of teaching today. I'm going to use PowerPoint. So maybe just think of this as like you've tuned into a podcast with some slides. But I do want to invite you to use the chat. You're welcome to throw things in there, comments, questions, etc. And I'll try to be catching them along the way. And I'll also ask you a couple reflective questions and might have you answer in the chat. Please feel free to not answer if you don't want to, or to answer. We're being recorded, I think, for SPJ's use, and I believe they can edit out the chat function, but let's double check that in case anyone's concerned about it. So if that concerns you and makes you not want to answer. Kate, sorry, I didn't think to ask that.
Yeah, well, we are planning to post this on YouTube.
Okay.
So, but I do like this idea of allowing you to give the presentation, and then maybe we will cut off at that point, and then that way people can use this as a space if they want to share some personal stories and not have it on the web.
Okay, great. Thank you, Kate. So as Kate said, I'm a psychologist, and the DART Center is actually at the Columbia School of Journalism. And so there are several of us who work together to create material and training and opportunities for conversations around what happens in trauma-facing journalism. In other words, how do you all do ethical work, good work, effective work, while not harming subjects and sources, as well as not harming yourselves and the communities you're also part of. So today we're going to be thinking about those spaces, and I'm going to start us off with some slides. Okay, so what I want to do right now is lay out some frames for you all. And we're thinking today about stress, trauma, and burnout. And we're not going to get like heavy duty into the definitions of everything, but I am going to spend some time delineating stress and trauma, and also really trying to convince you that you can become aware of the impact of stress and trauma on you by understanding your own biopsychosocial functioning. So there's a couple things I'll hit quite a few times, terms that I like to create as vocabulary, and I hope they will feel applicable. My background, by the way, is as a trauma specialist for the last 25 years. I've worked a lot with communities who are in conflict, refugees, folks seeking asylum, as well as individuals who are incarcerated. I do a lot of work with folks in prison. And then for the last 10 to 12 years, I've been working more with journalists. And it used to be, by the way, that when someone was asking about journalists and trauma, they were really only asking about, conflict journalists or war trauma, stories for in the media, and that those were the folks who were really facing trauma. And I think what we've really seen emerging in the last 5-7 years is that that's really no longer the case, that journalism is itself a potentially trauma-facing field, and we need to arm journalists with the kinds of tools that will help them cover things well as protect themselves from the imprint of trauma. So a couple quick agreements as we start. This is a space where I'll be doing some teaching and you might be doing sharing. So we're keeping confidence and respect to all, folks' comments. I just want to acknowledge our own histories and backgrounds. Anytime you're having a talk about hardship, pain, or trauma, you are necessarily in the waters of what might be your own life experience. So we're going to be thinking today respectfully about each other's histories, recognizing we don't really know them. And I want you to kind of be thinking that about your own news organizations, your newsrooms, or your colleagues too. You don't know what someone's life experience has been and what might actually affect them. That said, I also want to acknowledge just the privilege and the space that we're in by being able to spend this time in a kind of professional context, talking about hurt and trauma, something that many people don't have an opportunity to do. That leads me to realize we may have lack of understanding about certain issues. So we just try today to be open and in good faith as we're sharing ideas. Okay, so let's talk about some terms, first of all. So I want to begin with a context of thinking about journalism as a field that necessarily has a trauma-facing component. No, it's not that every piece of journalism is drenched in trauma, but one of the things we're going to talk about is how much in contemporary times journalists do face really severe stress, and which sometimes really tips over into the level of trauma. So what we like to think about at DART is, what are your tools, right? Just like you need good tools as an editor, a writer, a photographer, an audio journalist, you need tools also when you are outwardly entering a situation in the world in which there's been violence or tragedy or harm, man-made or natural disaster. So we like to encourage journalists to have some outward-facing skills or tools that they use when they're facing sources, interviewing subjects, photographing communities. And that's really not so much what we're going to focus on today. Today, we have a lot of material on the DART website about outward-facing tools for covering trauma. Today, we're going to be thinking more, though, about what we're going to call inward-facing skills. That is, what do you use for yourself and for your teammates, your team members, your colleagues, to make sure that the work, the trauma, the stress is not taking too high a toll on you? Because in my experience, 25 years working in a trauma-facing field, and I feel quite, I have a lot of affinity for journalists because I too work in a field where you wade into things that are painful with people. And so I have a great affinity for the fact that I have had, that like you all, I've had to build a toolkit for noticing the imprint of trauma and stress on myself due to my work. So let's think about it a little bit. First of all, I just want to do a quick reflection with you, which is I want you to think right now, sorry to put you in mind of something negative, but I want you to think of a stressful professional moment that you experienced recently. And you're not going to put this in the chat. I just want you to think about it for a second. And as you think about that, just think about what helped you. Did anything help? And if you're comfortable putting that in the chat, feel free, acknowledging that we are recording. You don't have to give the specifics of the topic or what happened, but if you want to put in the chat anything that helped you with this difficult thing. Give you all a second. And if you don't want to put in the chat, that's fine. We can just think it through. Talking. Thank you, Zachary. Taking a walk. Yes. Okay. We're already getting into some skills that are very specific, and I'm going to patience. That's a great one. You've already started moving down the biopsychosocial continuum just with those three answers. So I'm going to just applaud those three participants who talked about talking, taking a walk, and having patience internally. And I see another comment about talking to a boss about a situation and reaching out to a friend. So this is fantastic. You're already halfway down the path, everybody. Quickly then, I want you to think of a time when a colleague seemed stressed. Put that in mind. Obviously, you're not going to identify the person or put them in the chat in any way, but just what's a time you noticed a colleague seeming stressed? And what did you do? Did you do anything? If you could be kind of broad about that in the chat, let us know. What did you do for a stressed colleague? Take a minute. Called him. Great. So reaching out, sending a text just saying you're available. Great. DM'd to check in to see if they want to get together. Picked up the work without prying. Great distinction there, right? So trying to be what we call instrumental in support. Is that example meaning do something, but also trying to be conscious and respectful of the person's perception of that. Great. So I'm seeing some reaching out, some texting, and some picking up work. Fabulous. Okay, so let's break this down a little bit. First of all, I don't think I need to convince you all that trauma exposure is very high in the field of journalism. What that means using our terms is that you all have a high exposure to trauma, meaning the stuff that's in front of you potentially can be very traumatic to absorb. That's kind of the what, but also the dose of trauma is really important in our conceptualization of the impact of trauma, because the dose is how much. How often are you exposed to traumatic material? How frequently and how intensely are you diving into really painful situations? And I have a feeling right now, if you all were going to put 1 through 7 in the chat of days of the week, how many days of the week would you say you're exposed to what you think is traumatic material in the last, let's say, 3 months? So the number would be 0 to 7. How many days a week have you been exposed to traumatic material in your work as a journalist? Okay, so we've got a 7 coming in there. Yep. 4. Yep. I'm putting a 7 for me. So just giving anyone else a chance to answer, how many days in a week in the last couple of months you've been exposed to what you think is traumatic. So, we've got a range already on the couple answers we have from every day to more than half of a week. And I'm going to argue that probably most of you have a fairly high number too. And again, depending on the news cycle, depending on what you're covering. What we also know, though, about trauma exposure in journalism is that you all have a high meaning profession. You have a profession in which the nature of what you do is you tell stories, and the nature of what you do is create coherence when you tell a story. And that is actually, from a clinical perspective, that's what we psychologists think of as a goal, right? Is that after something bad has happened, can you make meaning about it? Can you find meaning in the adversity? So I want to just start off by reminding you all that while this talk is going to be about the heavy stuff you get exposed to, I also want to remind you how much your field is one of high meaning, and that that's actually protective for journalists. So you all have a trauma-facing profession, right? I have a toxic symbol on the screen there because some of what you get exposed to is actually toxic, right? It can be harmful to your well-being. That can be whether you're covering a directly traumatic story, like you're at the scene of something that's happened, or in the aftermath, you're talking to people who were traumatized. Vicarious trauma is sometimes referred to as a kind of absorbing empathically of someone else's pain that can happen, especially in a longer term investigative engagement with a person where you really learn about something that happened to them. Secondary trauma we'll talk about, which is a tad bit more removed, but might be that you're exposed to imagery or audio or stories that are quite traumatic and they start to leave an imprint. And then targeted trauma, which, as you see, I have a different color red there because in my experience, this is really one of the most difficult kinds of traumas that journalists face, which is abuse, harassment, and actual threats. And as we saw very recently in a really tragic story of a journalist losing his life. So I want to just acknowledge that targeted trauma, in my opinion, as a trauma specialist, is a very difficult and the kind of experience that can really lead to a lot of negative consequences for journalists. Finally, all of these aspects of trauma, whether direct, indirect, vicarious, they may interact with something personal about you, right? Your identity, something you've been through. Let's face it, COVID was not a story that journalists told from over here, right? You had to be telling COVID stories from within places you might have been exposed to it or faced your own illness with it. Same for issues around racial violence, persecution, LGBTQ violence and persecution. These stories can be directly linked to us, the journalist who's telling the story. So that can heighten the impact of the stress of the story, the trauma of the story. So let's think a little bit, though, about what's also true about journalists, which is that you all are a very resilient bunch. You are, this has been shown when we study this at DART. We see that, yes, you have a high exposure in your field, right? High dose, high exposure, but your rates of post-traumatic stress are actually comparatively pretty low. And in a minute, I am going to teach you what PTSD is, not because I want you to walk around diagnosing yourselves, but because it's really good to recognize the symptoms of PTSD so you can kind of catch them if you're having trouble with it. Most journalists return to kind of a sense of equilibrium after a tough story. And they tell us that, yes, the craft really helps. Talking to colleagues really helps. Doing that work in a meaning-making way is actually protective for journalists. But we also know that journalists tell us that when they get injured psychologically, suffering moral injury or really conflicted feelings, it can be really difficult. Okay, so we know you have risk, we know you're resilient. So let's do a little bit of terminology, and then I want to actually teach you a little bit of what I call trauma 101 about the imprint of trauma. So first of all, stress and trauma are not the same thing. Stress is actually a normal part of human functioning. I'm sorry to tell you, you can't really have a stress-free life. Stress can come up from all kinds of things: finances, family, personal life, deadlines, stuff with colleagues, your health. And it doesn't mean these things are no big deal, right? They can really take a toll on us. But stress is something that usually we deal with fairly regularly, and we expect some version of stressful events to be part of life as an adult. Trauma is different. Trauma is an event or events that really overwhelm the person's functioning, overwhelm their coping, and require what we're going to call a body reaction for survival, biopsychosocial. So we're in the bio realm first right now. Your body has to respond when you are facing something that is life-threatening or very, very overwhelming or very, very frightening. What we also know, though, is that trauma that you witness can also have a biological adaptation that you have to make. In other words, your body can react to witnessing trauma and have some of the same problems. So what we also know about trauma is it's cumulative. That is, one trauma can be very hard on a person, but what's clearly been shown is that the more trauma a person suffers over time, or the more intensity of it that kind of builds for that person, the more difficult it is to function or to not have some imprint from that trauma. So stress and trauma are both words that I'll use a little bit interchangeably here, but they are different. But they both affect the next thing that I want you to be thinking about. And I want you to start really paying attention, because here's the part of our podcast where I want you to be checking in on yourself. These things affect our biopsychosocial functioning. Okay, what do I mean by that? Well, first of all, we know that stress and trauma together can interact. They're not just these unique, separate, mutually exclusive things. So if you look at these little beakers here on the page, you know, we've got all the kind of daily stuff that can be hard in life, the stressors on the bottom, right? Deadlines, equipment issues, your editor's not happy with you, you got money to, you know, you need to make. And we know that those things fill up our stress level pretty high. Then what interacts is trauma. Trauma like, you know, COVID, you've been sick, you've got long COVID, or someone you love has been ill or has severe COVID. You are covering something severely distressing like a mass shooting or some other really horrible, violent event. You have your own personal trauma that happens or that gets stirred up from events in the news, or you suffer some really ugly online threats or abuse or harassment. That can create this interaction between, you know, trauma with a capital T and stress of daily life as a journalist that really, really can make journalists feel tired and unable to function. So what do we mean by this biopsychosocial interaction and what it does to us? Well, I want you just think for a minute what it is to be a human, actually, because really we are biopsychosocial beings. And what we mean by that is, first and foremost, we are an organism, we're a body, and we're walking around in this organism that is wired to survive. And I want you to think about that a minute. Your body, your human organism, is wired in a way that if a threat comes to it, it is going to adapt. It's going to try to keep you alive. And that's an amazing part of being a human. But what we know is that trauma, actually, when it has to activate those biological survival mechanisms, tends to then leave an imprint in the aftermath of trauma. And I'm going to teach you what that is in a second. But I want you to just think for a minute about your own body on this Saturday morning on the West Coast, and afternoon here on the East Coast. And just think about the fact that your body's carrying you around right now, and just give it a little appreciative pat, because this body has gotten you through whatever you've had happen in your life. And that means your body has taken care of you and has kept you surviving. And I just want to say that to remind us all that in the face of stress and the face of trauma, our body takes a toll. It carries the toll, and it also then needs care and needs what we're going to later talk about as tending. We need to tend to this organism that's keeping us going. We are psychological beings too, right? We are wired to make meaning. And as I said, journalists have a meaning-making field, right? That's what you all do for a living. But we humans walk around, and this brain in our head also has what? A mind. And your mind is constantly telling you a story, right? So you right now are telling yourself a story about this webinar you've attended, right? Maybe you're saying, oh, glad I came to this, or, oh man, I don't know if I should have used an hour of my day on this. Whatever you're doing, you're talking to yourself. And one of the things about meaning making is it's actually quite reflective of trauma, meaning if we suffer trauma or suffer severe stress, our meaning making often adapts into negative, self-attacking, self-blaming, sometimes guilt-filled, and sometimes shame-filled meanings. So in other words, meaning making becomes another path by which trauma leaves an imprint. And I've been doing trauma work for 25 years, and I can tell you, if there's one thing I wish I could magically find the solution for, because it's so hard to change, is the fact that humans so quickly turn towards negative self-attack when they are under stress or when they've been hurt. So I want you to be thinking for a minute now about your own meaning making. And in a couple minutes, I'm going to take you through a reflection about how do you make meaning. But I want to hit that last component that we're thinking about today, which is the social piece. We are wired to attach to each other. Humans need each other. We need touch, communication, support, nurturance. And if we don't have it, humans have trouble. We degrade, or we have problems. Trauma impinges upon our social selves also. It makes people do what? Isolate, feel different than, and feel less than other people. And that's important, less than. I want you to think about that a second, because back to meaning making, right? Biopsychosocial. We tell ourselves stories after hard times, and those stories sometimes make us do what? Push other people away. So when you're really sort of thinking about the human organism and how it responds to stress and trauma, I want to invite you to think about these domains. By the way, there's other domains of functioning, of course, spiritual, cultural, universal, being in the, being on this earth as, beings as part of the planet. There's lots of other ways we exist. For this talk, I'm talking to you about the bio imprint of trauma, the psychological imprint of trauma, and the social imprint. Okay, let's keep it moving. I know I'm covering a lot. I'm going to keep going unless there's a question, and I'll look for it in the chat. Let me do right now a bit of kind of fast trauma 101 training for you all. And I know you all probably know a lot about the basics of the human response to fear because some of these terms are quite common, but let me spend a few minutes on it. So we talked earlier that stress is not the same as trauma, right? So traumatic stress, something traumatic, overwhelms that biological organism and makes the organism have to move into what? Survival coping. Okay, so that means that you can't logically think through a trauma. Your body is actually going to take a automatic response to it from what's called the autonomic nervous system, and it's going to try to save you. And again, it's a beautiful thing. It's an amazing thing about the human organism, but it can be very uncomfortable in the aftermath of a trauma, what your body had to go through. So let's just think about it a second. And I want you to pay attention to these two arrows on the screen because we're going to use them a bunch today for shorthand. And I'm going to try to teach them to you and make them become a tool for you that I use myself with all my patients and with my own self-care. And that is that the human nervous system has two fairly powerful responses that it uses when we're in trauma or stress. And they can alternate, they can blend into each other, but they are really, really powerful physiological responses to stress. And they are an uproar reaction, which we're going to think of as a red arrow going up. That comes from our sympathetic nervous system, and a shutdown reaction, which we're going to call gray arrow down, coming from our parasympathetic. Now, why am I spending time on this? Because I want you all to be thinking about that early question I asked you, a time you had a difficult time with work, or maybe suffered something that was frightening or dealt with something that was traumatic. And I want you to just be thinking about what body reactions did you notice when you were having a hard time. Let's use a kind of silly example for a minute, but just to make sure we understand these terms. We're going to look at this guy on the screen and we see that he is in trouble, right? He's running from a snake. So let's say this gentleman stepped out of his cottage in the woods and he looked and a big snake was coming at him very fast. So what I want to just illustrate right now is that his autonomic nervous system, which is wired to help him survive, is going to activate, right? As soon as his eyes see that snake, his body is going to begin a very fast process of filling him with the physiological responses that he needs to get away from that snake. So that's going to be that sympathetic nervous arousal response. That red arrow is going up. And what's it going to be? You all are welcome to throw it in the chat if you want, but what do you think happens when you go into arousal or fight or flight? What happens that gets you away from that snake? I'll give you guys a second if you feel like answering, but essentially we know that it's not that this man is going to look out off his porch and say, should I turn left away from that snake or should I go right? I wonder what kind of snake it is. If that snake is coming at him fast, he's going to not think, he's going to act. And the parts of his nervous system that are going to activate with that red arrow up are going to be what? His heart, his lungs, and his cooling system, his sweat glands. And what's going to happen is his heart's going to start beating fast. His lungs are going to give him quicker, more shallow breaths. His pupils are going to dilate. And all of that's going to happen within seconds to help him get away from the snake. Now, why does this matter? Because what we're going to also find is that when we go into states of what we call arousal, red arrow up, our body sometimes keeps a bit of an imprint of it, and it then can recur. And that means that after this guy's gotten away from the snake, he might go running back into the cabin, and he's going to have now the need for his body to come down, right, off of that high, not a high, but an activation. So he's going to come down with now the gray arrow deactivation, shutdown, in which, look at him on the screen here, he's going to need to rest. He's going to have to sit down. He might start crying. He's going to start talking. Oh my God, what happened? He might call his partner and say, you're not going to believe what just happened. Now, parasympathetic domination is happening in his body, which is he needs to rest and digest. Again, all of this around this sort of silly small example of this guy running from a snake is highly relevant to you all when you're out in the field or when you're having something happen to you in your work that is frightening. And that can include, I'm sorry to say, a threatening email or a really terrible comment where on social media reacting to something you've done that is abusive. You might find your body goes into a state of arousal as you activate that fear response. And after the trauma, later on, you will often then have this residue of the nervous system reactivity that comes back to you. And that's post-traumatic stress. So let me just explain PTSD real quick, and then I want to give you all a minute to ask questions in the chat before we move on to some tools. So PTSD is what happens to that person after they've suffered a trauma, and that fear cascade that they needed in order to survive, red arrow up, gray arrow down in the aftermath. All of it is happening at the same time that those events that he just suffered are being encoded in his memory. In other words, the guy's running from the snake, but what's also happening is his memory is codifying this into an actual memory in his brain. And with PTSD, that memory becomes what we call a hot memory. It is a hot memory because it's encoded with the sensory feeling of the event. So it's not like a declarative, hey, yeah, then a snake chased me. It's that he starts sweating again when he remembers it. He starts shaking. His heart starts racing. His stomach clenches. All of the things that his arousal system needed to do during that event have now gotten linked to the memory of the event. So if you're watching the screen, I'm hooking my hands together because the event itself and the fear activation that he needed, those survival bioreactions, have gotten linked now to the memory. And so the problem is people with PTSD or symptoms of PTSD experience the following. Remembering the event is the same as being afraid again. I'm going to say that again. Remembering the event means being afraid again. So when you talk to someone in the field, if you're covering a story that has involved violence or persecution or trauma or hurt or natural disaster, chances are you've talked to folks who have suffered trauma, and you might see a lot of discomfort as they start recounting the trauma. Why? Because their body is now cycling back through, think of the guy with the snake, the activation they needed in the trauma to survive, or they might be cycling into the shutdown, the gray arrow down. So PTSD is really, I want you to understand it as sort of the imprint of trauma returning to us with what we call re-experiencing, even when we're outside the trauma. Again, why does this matter to you all? Well, you might be covering trauma, so there's clearly the outward-facing skill, but I want you to be thinking about yourself too. Have you had an experience where it was frightening, something you were covering, or it was distressing or disturbing, and it made you feel an activation of fear in your body? If so, you might have had then afterwards some symptoms of PTSD. Again, I'm not saying people have PTSD, but you could have symptoms of it. Just want to cover that for a minute on this blue circle on the screen, which is that the cycle of PTSD is that the fear reaction gets linked to the memory. So the fear that got him to run from the snake gets linked to the memory of the snake. Then, and this is important, in the aftermath, memories of that event trigger a real fear reaction. Red arrow up gets triggered, or maybe gray arrow down gets triggered. And then, and this is really important, the bottom of this circle, what do people do? They really try to stop that from happening. So people who've been through trauma try to avoid it, push it away, deny it, or really not talk about it. So think about that for you all out trying to get interviews. Obviously, that makes that task kind of challenging. If you're facing folks who've been through trauma, they might really not want to talk about it. But also for you, if you've been through difficult things, it's very hard to tell somebody about it. And some of you mentioned that in the beginning when I asked what helped when you were having a hard time, and you said talking about it. So that's a great thing to do, even though it's not always what we want to do. Okay, I want to just give a minute here, because I know I've covered a lot, to just say, if you have a question right now, you're welcome to put it in chat or in Q&A. I am also happy to keep moving because I want to talk to you a little bit about some of the tools that I recommend and that we talk about at DART. So I'm just giving everybody a minute. Been talking about the biopsychosocial imprint. We're talking about the autonomic nervous system reaction that stays with us after something distressing. Okay, I'm not seeing questions, so I'm going to keep moving, but feel free to put them in there. I will get a little notification. So just to get our terms straight, we've been talking about stress, which is normal, but can really overload us. We've been talking about trauma, which is its own really specific bodily adaptation. Yes, viewing violent. So someone's asking about viewing violent imagery. Great. So we're going to do that right now. Thank you for the question. Secondary traumatic stress is actually a very specific experience in which exposure to something traumatic comes at you through some other channel, images, stories, recordings, or maybe just a person telling you. And yes, what we know about secondary traumatic stress, look at those two arrows. What does that remind you of? Yes, it can bring the same symptoms that post-traumatic stress can. In other words, it can activate you into arousal. And I want you to look at these bullet points for a second on the left. A couple of these are more arousal bullet points, right? So irritability is part of the nervous system arousal, feeling angry, having concentration and focus problems is often an activation problem, but also secondary traumatic stress can lead to shutdown feelings. So feeling numb, fatigued, not able to cope, feeling isolated and having changed meanings about the world. So what we know about secondary traumatic stress for journalists is that it's a real thing. And it's not that every time you see something distressing and have a bad memory of it, it means, oh my gosh, you have a diagnosis. That's not what we're saying. But what if you started really paying attention? In other words, what if you started noticing, and I'm going to use that word a bunch, the things that your body, your meaning making, and your social interactions were telling you? Because what I'm going to argue to you is that your biopsychosocial functioning is the road by which you notice where you're carrying stress. So yes, intrusive imagery is, violent imagery, we are told again and again by journalists that it causes trouble. It can cause sleeplessness. It can cause what we call intrusive re-experiencing, meaning the memories come back. The images come back. And it can cause a sort of shutting down reaction as well, where journalists start to feel numb and like they don't even notice reactions anymore to violent imagery. So my first invitation to you all on that is paying attention. What do you do when you see something graphic or have to deal with it, edit it, put it up online, whatever? What do you do to notice your bodily reaction? That's actually the first step. So let me keep moving on some of these tools, and we'll keep thinking together about what to do with secondary traumatic stress. To do that, I actually do want to give you a little moment of self-assessment. And I'm going to put up on the screen 3 different categories, biopsychosocial, and some things that we hear people who are doing trauma-facing work tell us are problems that they sometimes feel. So just take a minute and see if you feel like some of these you've struggled with. And again, you're welcome in the chat if anybody wants to put like a yes or a 3 of them or a 10 of them or anything. You're welcome to comment on in the chat. No, you don't have to. I can tell you from my own work as someone doing trauma-facing work for a long time, I have struggled with each of these probably. I'm just scanning again, many of them. And these are normal, I want to say normal reactions to painful experiences. It doesn't mean they feel okay. It doesn't mean you should just be like, oh, well, that's life. But these are normal human reactions. So what do the biological ones tend to be? They tend to be around things like sleep and irritability. The psychological ones are about what? Meaning making and feeling sad or despairing or having changed feelings about the world from what you're covering. Or notice that bottom one on the middle column, self-attack, huge indicator of stress is when you are attacking yourself. And then the social realm tends to be either isolating and staying away and feeling different than others, or when you're engaging with people, feeling irritable, angry, or impatient, or misunderstood. So I want you to just notice that imprint a little bit and see if any of your, if anything comes to mind. I've got a question coming up too about, this is great. So the idea of thinking about the social imprint, is isolation necessarily a detrimental or a negative or a symptomatic problem? And I would say absolutely not. Being alone can and spending time alone can be a very fueling process for people. And this tends to get described in terms of introvert, extrovert. I think some of that stuff's a little too simplistic, but absolutely time alone is really can be a very positive fueling time. However, here's what I would ask as the query to someone who says to me, my work is really stressful, I'm covering really hard stuff, and I just want to be alone. I would say, okay, let's just do a little deeper analysis. Let's notice, I told you I like that word. Let's notice what the psychological piece that goes with that time is. When you're on your own, are you feeling refueled? What story are you telling yourself? If being alone is a time when you fuel yourself with, nurturing or even self-assessing, kind of thinking about, how you're doing with your work or thinking about a piece, that kind of stuff. To me, that's healthful. But if your time alone is actually punctuated with a lot of self-criticism or ill will towards others, feeling like nobody understands you and why I don't feel like being with anyone, nobody understands what I'm going through, then I would argue isolation is moving less towards a health promoting kind of behavior and more towards possibly detrimental. So, what I'm inviting you all to do is be curious and be discerning about your reactions, be discerning about your meaning making, be discerning about your social time with others. It's going to lead you to figure out where you're finding stress difficult. Okay, I'm going to keep moving for a little bit. I want to do a couple skills with us before we finish, a couple reflective, what I hope will be skill building exercises. And I want us to think now about what our inward facing skills. So we're not talking about being out in the field and doing interviewing, and kind of facing subjects and sources. We're talking about ourselves and our teams. So how do we pay attention? And if you haven't figured it out by now in this first 45 minutes, I am a huge believer in self-assessment. And at DART, we argue for people being able to notice their own reactions as half the battle for being a trauma-aware journalist, which is that you need to pay attention to yourself. Don't ignore yourself. I know journalists work long hours. I know you all have to push through in all kinds of difficult situations, but that doesn't mean you have to ignore yourself. One of the parallels I like to use, because I feel this too about my field, is the parallel of a surgeon. So as another career that is trauma facing, surgeons don't just pull into the parking lot at the hospital, get out of their car, walk into the operating room, grab a scalpel and start working on someone's knee, right? Surgeons have a very clear process around the before, the during, and the after of their trauma facing work. They know that as they move towards this person, there's risk, right? There's risk to the person, and there could be risk to them professionally if they do a bad job. So surgeons have a very kind of rigorous procedure for approaching each trauma-facing task they do. First, they clean up, right? They get hygienic. They turn to their team, make sure the team's all there. They look to make sure all their material's in order, and they check to see what they're about to look at. I'm about to do the right knee, and it's got this problem with, cartilage. Once the surgeon is in the middle of the trauma-facing work, they are focused, they're using their intellect, and they are not being necessarily stimulated in a negative way by the fact that there's blood or something's, looking messy. They're working and intellectually engaged, something you all do all the time when you step into that flood zone, or when you come upon a police scene that you're going to report on, or when you interview somebody who's just lost a family member. You all use your intellect and your skills. But after, just like a surgeon does, do you find time to clean up, pause, notice how you did? How did you do with the task of extricating information, right? How did you do for yourself? How did you do for your subject? Surgeons are a model, I think, of trauma-facing work that actually some of us in the field of psychology and definitely in journalism could use a bit more, which is that before, during, and after. Okay, so let's think a little more then about some of these skills. First of all, I'm a huge believer in the fact that when you do trauma-facing work like I do, you have to have pleasure. So I can't see your faces right now. Chances are people who saw this picture smiled. And why? Because you had an involuntary reaction to something nice. So what I want to argue for is we don't only have to walk around in our trauma-facing work feeling the involuntary reactions that come from negative experiences. We can also find the positive, do things you enjoy, go have pleasure. It's really hard to do sometimes, especially if you're covering hard stories. Sometimes journalists say, I don't really feel like I deserve to, have my nice life after some of the folks' lives I've covered. And that is a really understandable struggle in meaning making. But I would argue that you cannot do good work in any kind of profession if you are not filling your own needs for pleasure and positive interactions and joy. So that's a reminder with that picture. Okay, let me teach you a tool that I really like that is about recognizing the reactions of your body. And I want to invite you to actually try to do this with me if you can, which is you're going to be paying attention to this graphic. And there's this called the window of tolerance. And the window of tolerance is a construct we use in anxiety disorder treatment. And we use it to teach folks to notice their reactions. So the green part of this graph is what you're going to call your window, the window of being able to cope and you're kind of in your optimal state. Is the green zone, right? So the green zone is I'm working, I'm able to shift tasks, I'm feeling okay, I know what I've got to do. You all are in the green zone many, many hours of your day, I imagine, because you're functional journalists in a high-level job. However, your body can't stay in the green zone all day. It's just not possible. Bodies have to move into other states, and sometimes they move into states of arousal. So we're going to think of that red arrow up, right? And when you move into hyperarousal, you're going to feel what? Agitated, edgy. You might have trouble concentrating. You might even feel like tightness in your chest. That is a sign that your body is telling you, I'm getting a little activated. Now, this could happen because some piece of news that you're covering is distressing you, or maybe you had an interaction with a colleague that was bad. It can come from all kinds of things. But hyperarousal, if you notice it, you can start to do something about it. I'm just looking at a comment coming in. Yeah, this is really very important question has just come in around layoffs and the instability of the field. So we're going to think about that in a second. And thank you for sharing that. I'll come back to that in our next reflection. I just want to finish window of tolerance a quick second, which is that the other part of our window that we shoot out of is going down, right? Which is now moving into the gray arrow. And you go into what you call hypoarousal. How many of you all have been on a Zoom meeting and you start to feel drowsy? And what do? You probably just drink a cup of coffee, right? Or prop your face up. But what if we actually paid attention to our bodies saying, I'm starting to go into shutdown, and let our next action be something that respected that. So in other words, when you go into hypoarousal, you might need a rest, or you might need to walk around the block, or you might need to just take, a 10-minute, 15-minute pause and sit someplace. But what if you actually did pay attention rather than just pushing through? Same with hyperarousal. What if you noticed that you felt agitated, paused? I'm going to be a big believer in the word pause in a minute, teach you about that, and actually tried to address hyperarousal with using some mindfulness, some breathing, things like that to calm you down. I'm going to take you through those in a minute. Sorry. What I'm arguing for is a kind of process where you first attend to yourself. That means pay attention, notice, and then you tend. So attend, tend, attend, tend. And this is actually a tool I use with folks where, we teach this and say, right now, I want you to pay attention. What are you feeling in your body? What are you telling yourself? What are you doing with other people, right? I'm going to notice my bio, my psycho and social, and my social. And then I'm going to find a way to do something for those areas that are having some pain, some discomfort, or some hurt. So let's do a quick example of attending for a minute. I want to actually just invite you for a quick minute to do a scan of your body with me. So again, imagine you're in a podcast land, and I'm going to walk you through a quick body scan. And if you can, just try to, if you're multitasking right now, stop multitasking and try to listen to my voice. And I want you to imagine just pausing right now and letting yourself notice your body sensations. Okay. So I'm going to invite you to just sit up in your chair a second, or wherever you are, put your feet on the floor. And as you put your feet on the floor, I want you to imagine a light that is kind of hovering above your head. And the light is just going to quietly and nicely and warmly move down your body. And as I narrate, I want you to just imagine the light touching parts of your body and just pay attention for a minute to that part of the body as the light hits it, and see if you notice any sensation, pain, discomfort, relaxation, tension, anything. So let's start. This will take us about 45 seconds, but I want you to picture that light hovering right about here. And imagine the light just slowly coming down onto the top of your head, and imagining that it's just resting on the top of your head. What do you feel in your body on the top of your head? Sensations. Just letting that light sit a minute, and now slowly it's moving down your forehead. What do you feel in the forehead? Feel tension, scrunching up, relaxation. Letting the light move down your face, imagining it down the front of your face right now, on your front of your cheeks, and on the back of your head. What do you feel on the back of your head? Letting the light move down to your jaw. Jaws have a lot of tension often. Notice that jaw tension if you've got it. Move it around. Letting the light go down your neck now, and your back of your neck and your throat. What do you feel there? Imagining it moving to the top of your shoulders, places where we have lots of tension. Moving down your shoulders to the top of your back and the tops of your arms, just letting that light just kind of pass through. What do you feel? Take a breath as the light moves down your chest and your lungs. How does that area feel? Imagine the light moving down into your torso now, into your kind of gut area and your lower back. What do you feel in those parts of your body? Imagine the light moving down through your hips, your backside, down into your top of your legs where there's a lot of muscle. What do your legs feel like? Moving through the top of your thighs into your knees, which do a ton of work. What do your knees feel like? Letting those knees sit for a second and imagine that you're paying attention to them instead of just taking them for granted. Moving the light down your shins and calves. A lot of muscle there, a lot of blood vessels. Letting the light hover down towards your ankles, to the tops of your feet, and to the bottom of your feet, which do so much work. When's the last time you tried to pay attention to them a second? What do they feel like? Now that scan, if you did it, it's just a little meditative chance to pay attention to your body. It's just about noticing your body and paying attention to where there might be signs of stress, signs of pressure. And once you do that, the question becomes, what are you going to do about it, right? Like if you're having body pain, if you're having sensations of stress, do you ever address them? Do you work out? Do you go to see a healthcare provider? Do you do stretches or yoga? Do you go for a walk? What if you intentionally notice your bio and then put in place something to tend to that part of the body that's showing stress? I do the biological scan on myself at least once a day. I try to do it in the morning when I get up, but I really try to do it when I notice something is either turning me into a state of hyperarousal, arrow up, or shutting me down. I try to then quickly check my body. I work in a trauma-facing business. I have to do this sometimes on the fly, sitting with a client, maybe in a prison or someplace where I'm, absorbing pretty heavy trauma. And I want to invite you to practice it. It really is a useful tool. One other way you can scan yourself, though, and assess yourself is in the psychological domain, which is check your meaning making. And we're going to do that in a second. Before we wrap up, I'm going to have you do a quick exercise on meaning making. But the idea of a meaning making check is, what am I telling myself today? How many of you, when you're feeling bad about something and you're saying some kind of negative stuff to yourself, how many of y'all just take that at face value versus actually pause a minute and say, wow, it's interesting that I'm being negative about this right now. Why am I being unkind to myself? Why am I feeling self-attacking or blaming, myself for something that really wasn't my fault? That is what you call sort of a critical and assessment of your thoughts, as opposed to just taking our thoughts at face value and saying, yeah, our thoughts are always correct. So psychological assessment is also just checking in on your meaning making, and social scanning or social assessment is the same. Hey, what am I doing with people? When's the last time I reached out for help? Now, those of you in the early part of the talk today who mentioned what you needed for help, you each mentioned a bio, a psycho, and a social skill, right? Because one of you said you talked to someone when you were having a hard time. That's a social outreach, right? Another one said you try to have patience. That's a meaning-making piece, right? I'm going to have patience with myself during this hard time. And the other person said, I went for walks. So you have natural ways you do these things. But what I'm arguing to you is that putting them in an intentional place can actually feel like a more active well-being plan for yourself. So I want to take you through one more piece around meaning making, and then we'll finish up soon, which is I want to actually invite you to do a quick meaning making analysis for yourself on something difficult. And I'm thinking about someone who put in the chat a comment about, what about the instability of the field? What about being laid off or feeling afraid of being laid off? These are such difficult parts of the journalism field, and they're reality, right? There's nothing to be, it's not an exaggeration to say you are in a field that has a lot of challenges economically in terms of stability. So what do you do with that? And again, there's therapy offices all around the world in which people are engaged in analyzing their own meaning making. And I want to say to you, some of that you can do yourself. So let me give you an example of how to assess your own meaning making. So I want you to think of something stressful about your work. Okay. So sorry, but I am going to put you in mind of something stressful for a minute. And I want you to just think about a stressful situation, or a problem you've had at work, or something really causing you discomfort. Now, actually, as we do that a second, do a quick scan of your body. Do you notice anything as you put yourself in mind of this? Does your stomach clench? Do you feel like, I don't really feel like thinking about this right now? That's kind of an avoidance technique. That's pretty normal. So as you think about this thing I feel bad about, I want you to just imagine filling out these two columns. On the left side, you're going to fill in for me, what part of this situation X do I have control over? And just list anything you can in your head or do it on paper that you do have control over. I'm going to do this myself. So you should be looking at what do you have control over of this situation? What can you actually do? Or what did you do if this was in the past? And as you're thinking about anything at all you've done in relation to this or can do, no matter how small, I want you to now flip over to the other side, which is what parts of this situation do you have no control over? So again, anything at all. It can be large, huge kind of systemic things you don't control, world things we can't control, or things that you can't control in your environment with your boss, with your colleagues, whatever. Just fill that part out for me. So as you're assessing this, I want you to just, yeah, thank you. We have a comment that I appreciate, which is shoulders went up. That's such a great observation from someone that when they thought of the stressful situation, they wrote, my shoulders went up. And that's a great one. And by the way, pay attention. If you start noticing things like your shoulders, your back, your jaw and your throat area, you're going to catch where your anxiety lands. Those are very common areas. So thank you for sharing them. So as you do this analysis, if anyone wants to throw in the chat anything they noticed or observed in this assessment, again, you don't have to disclose anything personal. And if you don't want to comment, that's fine too. But what do we notice when we actually step back from the very difficult parts of a trauma-facing job like you have? What do we notice when we actually break down there's parts of this we really don't have control over? And oh yeah, that's great. Okay, we can unmute folks if anyone wants to comment, or I'm going to give you time for questions too that can be done on microphone. So this process, again, feel free to comment or question about it, but the job here is to be able to separate your meaning making from what you are doing something about and what you can do something about, and the coping that is required in this problem you're having from what you can't do anything about. And those two coping strategies are quite different. On the left, the stuff you can do is what we call action-focused coping. I had to work in a context in which the outcome was going to be something very bad for a person who I worked with in prison. And I worked very hard to try to prevent that outcome, and I was unable to. I worked very hard on the action-focused part of my work on that situation. And I really spent time and I tried to do a very good job. But what ultimately I became aware of was that there were very many larger situations in that person's situation in the context that I had no control over. Large systems, injustice, inequity, things like that. And it didn't make me feel better, but it made me realize that those parts were more things that I needed to work on my emotions about. Understand that I felt sad, understand I felt upset, understand I felt powerless. So I'm inviting you to try this kind of analysis yourself, and I hope it's landing. I have no idea because we're not, in a room together. Feel free to pop in the chat if you think this is a useful construct, but I'm inviting you to use it as a tool when you, or maybe use it with a colleague, are struggling with something where you feel powerless, distressed, or upset. There's a lot of stuff we don't have control over, especially in the kinds of stories that you all are covering that can be really difficult, like climate change, like shootings, like political situations that feel out of control. So I want to invite you to recognize that things out of our control can be coped with, but some of it is sitting with the discomfort, sitting with the pain of it. So I'm not really answering that question, I think, in some concrete way that was really powerfully raised about what about things like layoffs and losing jobs. And because what I think I'm referencing it here to say that is a situation that can really make a person feel powerless. And it can feel very unfair. So let's just turn for a minute then to helping each other, because as I raise that issue of things like cuts in the newsroom and job instability, I imagine there's times you all need to turn to each other and talk about that. So I just want to make a few points about that, and then I'm going to give us like about 7 minutes to just ask questions or share stories. But being a good colleague is part of a social, biopsychosocial strategy in response to stress. Why? because turning outwards has been shown to be good for people. So when you're under stress, what do we want to do? Turn inwards, right? What do we say to ourselves? Nobody understands me. I'm alone. I'm messed up. What we actually find is that when people can go outwards and they can tend to others, just as a way they tried to tend to themselves, we find that people feel better. So those of you on the call who have a colleague you've thought about, in the first part of this talk today, I asked you about a person who you thought might have been struggling. What did you all say? You reached out, you texted, you sent a DM, you did something to touch that person. That is a very intentional strategy for providing social support. So just for a minute, we know social support is really, really helpful for journalists. And what we find again and again when we study journalists is that journalists who are feeling badly are usually journalists who say, I don't have social support. So I don't know if that's causality or not, but what we're saying is people who are resilient and feel good in the field tend to be quickly able to identify who their social supports are. They can say, yep, I have this colleague I always turn to. I've had this boss or this editor who's great. And in my personal life, I have these people. So pay attention, right? Attend, notice your social support. Now, how about that colleague you've been worried about? Let's think about, how do you know when they might be in trouble? Well, just start to notice, right? Does this person not show up? Do they never have their camera on? Are they often talking about staying up all night? Are they talking about sort of not being able to get their work done and feeling inadequate? Are they withdrawn? Just start noticing signs. And again, it's not like someone having one bad day means, oh my gosh, they're in trouble. But what if by paying attention to your colleagues' difficulties, you actually could jump in there and maybe just be that little day's worth of support that helped them feel better. So for instance, one of the things I recommend is to just ask open-ended questions to folks and reflect back what you hear. So in other words, hey, how are you doing? I noticed you weren't on the last couple meetings. How you doing? Everything going okay? And letting that person tell you, and then telling them what you heard. Hey, I'm hearing you, that you've been kind of hanging out on your own. Okay, I'm hearing that you're just not feeling like seeing people. That's literally just reflecting back what you hear. It's a very powerful listening tool, by the way. Acknowledging someone's stress and not trying to fix it is actually a strategy that can be quite relieving to people. Because I don't know about you all, but how many of you all have complained to someone you love about something hard in your life, and then they've immediately said, well, why don't you do this? It can be a sign of great love and commitment when people try to fix our problems. But often we've tried those things. So what really, really can be helpful to someone is to just say, hey, I really hear that you're under stress, and I just want to kind of catch your burden a little bit. I'm right here. Another thing that we know from our journalist colleagues is that remote contact does take extra work. You all are a professional society. SPJ is a great opportunity to reach out and touch each other, right? It takes more work these days. Why? Because you're not reporting to an office. We're not sitting together in the same spaces like some media organizations were before. So reaching out does require work. And if you want to be a little more instrumental for a person, that is providing social support where you're doing something, you might want to say, is there something that could be helpful for you this week? Either that I could do, or that I could help somebody else, like rally for you, or that, you just want to think through with me. So, again, being active for folks is really, it's pretty basic, but if you've ever had someone reach out to you and say, are you doing okay? I think, it feels quite good. So we want to endorse for you all in this very heavy duty time of being journalists to remember to turn outward to each other, and don't be afraid to give resources. We find that folks, want to know what's out there. Sometimes people say, hey, I'm using the EAP and they're kind of good. I had a pretty good counselor and they saw me for 10 sessions. There's also at DART, we have something called JTSN, which I'll share at the end, the Journalist Trauma Support Network, where we have 20 therapists who we've trained to work with journalists. We've trained them on the culture of journalism. We've trained them on some of the challenges of journalism. And we have currently a pilot project running at DART where we're providing 20 sessions of therapy with one of these therapists. You have to just meet criteria. You have to be in a state where we're licensed. And the reach that you have to reach out and give a little bit of information on what you'd like to work on. But even if you don't use something like that, there are other supports and resources out there, including faith-based organizations, community-based organizations that can be a support. So like SPJ. So check back in with that colleague who you're worried about and let them know, hey, how's it going this week? It seems like you had a kind of cruddy week, and I'm just making sure you're okay. So I want to give us a chance to have questions, but before I do, I'm just putting this up because I just mentioned it. The Journalist Trauma Support Network is located at that website. And there's also an organization called ISTSS, which is a study, International Society for Traumatic Stress Studies, who has a clinician directory that you can use. So anybody have thoughts or questions or anything you want to bring up